This is Cruise News. Welcome to Hot Topics with Haley. American healthcare is currently in crisis. With the increased cost of drug treatments not offset by insurance, terminally sick patients often cannot afford the treatments they need to survive. Recent statistical polls show that overall, Americans have an enormously negative opinion on big pharmaceutical companies. Only 28% of Americans have a positive view, while over half at 51% have a negative view. Because of the Medicare Prescription Drug Price Act, the U.S. government is prohibited from negotiating the price of new drugs. The only factor determining drug prices is the ability of the market to bear it, leading to pharmaceutical entrepreneurs purchasing drug patents and dramatically increasing the price. For example, the price of Mylan brand EpiPens needed by citizens with life-threatening allergies have increased from $100 to $600. That's a six-fold increase in drug prices, and one EpiPen only takes $30 to produce. This issue spans not just the pharmaceutical industries and the government, but also the scientific researchers themselves. Let's get some expert opinions on how to solve this problem. Reporting live from the health office, let's go to Nicole the pharmacist.
While I can admit that the rising prices of pharmaceutical drugs are affecting the way that the general public consumes and purchases them, the pricing is critical to understanding the relationship between pharmaceutical R&D and human health. According to Gobrowski, an economist at Duke University, without a well-structured system of patent protection, neither the research pharmaceutical industry nor the generic industry would be able to grow and prosper, as the rate of new product introductions and plant expirations would decline significantly. Because of the benefits that are associated with the rising prices of drugs, including heightened economic productivity, life expectancy, and quality of life, these increasing costs are directly proportional to the benefits they provide to society in the form of real wealth and real-life implications for the quality of life.
We're going live with expert Maggie Chun. Maggie, what do you think about Big Pharma?
Big Pharma has gotten too big. People the most affected by Big Pharma are those reliant on pharmaceuticals to survive, such as people who need EpiPens, morphines, etc. Due to those increasing drug prices, they no longer have access to the treatments they need. Furthermore, researchers who need funding to develop these drugs have no access to the profits that are made by these pharmaceutical companies. They're being sold out. I work on killing antibiotic-resistant bacteria. These bacteria are caused by humanity's overusage of drugs, or antibiotics. As Big Pharma feeds society with a stream of high-dosage, high-priced drugs, we actually create more problems than we solve, because using more antibiotics encourages the growth of these superbug bacteria. And that's just a small part of the problem. Doctors are also guilty of overprescription. When they encourage drug usage, patients feed into Big Pharma by continuing to over-purchase drugs. Here we have a never-ending cycle of misuse and overprescription.
To sum it up, Big Pharma is a controversial topic with many differing opinions. Some see that it is good, while others and most see that there are major underlying issues. But all in all, there needs to be regulation of big pharmaceutical companies.
In regards to these rising prices, due to the nature of the funding and the money it takes to research these pharmaceuticals, there is no way to decrease purchase costs in this inflating economy. However, a more open relationship between the FDA and the public and the larger corporations will help ease the minds of the masses. Disclosing information about why each drug is priced the way it is in a public statement causes each corporation to verify its costs and allows a more transparent relationship between all parties involved.
First, I think that there should be government regulation on drug prescriptions to prevent overprescription and encouragement of these drug companies selling and manufacture of drugs. Furthermore, I believe that a portion of the profits from these drugs should be appropriated to research scientists, who often spend decades trying to optimize a single drug. The costs of research development and FDA approval are extremely high, and for an independent researcher, they're often too much. If these funds are further utilized to encourage research rather than being collected by a select group of drug oligarchs, imagine the cures that we could create.